All right, welcome everybody. We are here today to talk about pain. We're here to define pain. This is the pain series. What is pain part 1? So welcome. It's time to define the different types of pain, their causes, side effects, presentations, treatments, self-care, and best chance of healing. Hey, I'm Coach Sean.
And I'm Dr. Kevin, and we're the FitHealth Pros.
And this is our pain series. It's called the pain series. This is What is Pain Part 1. We're going to talk about specifically acute pain, chronic pain, bone pain, soft tissue pain, and nerve pain today. So why don't we jump right into it? We'll go with number 1 with Dr. Fox, acute pain.
All right, so number 1, acute pain. So what acute pain is, it's going to be something that's mild all the way to a sharp type pain. It usually comes on suddenly. It can last a few seconds, so it'll be a burst or a quick pain, all the way up to 2 months, and usually caused by something specific. So if you're coming to my office, it would be something like a sports injury or an auto accident. If you go into an urgent care hospital, maybe something like labor pains, or you touched a hot stove, or you smashed your finger in the door. It is possibly limited with mobility. So usually is if you're in an accident or an injury.
Absolutely, yeah.
So you get that swelling type pain. You are probably going to have sore, intense muscles. The pain can be real intense, and it can kind of express itself to the point where someone may get depressed. They may have anxiety from it. But hopefully, if you have an understanding of this pain, that you know that it's going to be short-lived.
Right.
Okay?
Right.
And it's possible to get rid of rather quickly. So some of the treatments are going to be things like acupuncture, biofeedback, and these are alternatives here, relaxation and rest. We have self-care, which most people are going to do. So if you burn yourself or you hit your thumb, rest it, ice it, compression, elevate the area. You can use topical creams like a Sombra Gel, Biofreeze, or Tiger Balm.
Even natural remedies like aloe for a burn.
There you go, yeah.
You know, things like that. A little more natural.
So those are the self-care type of treatments, and usually what you're going to notice, it's going to go away once those tissues have healed, depending on the type of injury. So that's pretty much acute pain, and so we're going to get into the other type. It's the chronic pain.
So with chronic pain, this is where the pain can continue over months. It can continue even after the initial cause of pain, either the injury or the illness. That initial cause may have healed, and the secondary ailments could be chronic. Examples such as frequent headaches, nerve damage, lower back pain, shingles, sciatica, different types of pain that tend to linger and linger and linger, and that's when people will finally go get some help. Some of these therapies that can be very effective for chronic pain are chiropractic, acupuncture, physical therapy, hypnosis, electric stimulation, laser therapy can also be very effective in taking some of this chronic pain at least down into a more manageable range, much less fully remedying it over time. In terms of self-care, you can utilize foam rolling, different kinds of exercises, light exercises to kind of get you moving through the areas. Also range of motion, trying to release possible impingements, etc., through range of motion, stretching. Now the big thing is, when it comes to chronic pain, you got to be patient with the therapy. It's been lingering for months or into possible months, so it could take a while to remedy that pain. But you can try various therapies and see what works for this specific pain, whether it be a bone pain or soft tissue or nerve pain. But please be patient. Speaking of specific pains, let's go into bone pain next.
Sure. So the third type of pain, bone pain, is going to be very specific. So not a lot of people have bone pain, but just it will fall into the category of chronic pain as well. And I also just wanted to add in, there's a lot of information with this video where we're kind of hitting the bullet points. So we'll give you all of the notes that we have here and post those down below in a link.
Yeah.
So you can see all that, and so you'll get all of the information in a nice quick guide. So with bone pain, now there's usually a tenderness first, and that builds up. It can be extreme, it can ache and be uncomfortable. It almost feels like a deep bruise, but you're going to know the difference between a bruising pain and this bone pain. It is really uncomfortable. Now, what can cause the bone pain? Well, first one's going to be injury, so a slip or a fall or hitting that.
Probably the most common right there.
That's probably, yeah, that's going to be the most common, and that's the easiest to identify. And you can go back to the acute pain type of regimen for that. Other things like mineral deficiencies.
Right, over time.
It's going to be a little more under the radar, a little more hidden. You may have to see a medical provider or a nutritionist, get some blood work done to discover this. Worst case scenarios are going to be metastatic or bone cancers. Now, we take x-rays in my office, and if there is bone pain, no matter where you go, you want to get an x-ray of that bone to rule that out. That's what you want to do there. Infections in the bone and blood flow issues. I'll throw in one more, and that would be kind of growing pains.
Sure, growth plate.
For growth plate things,
Yeah.
exactly. So what happens? What's the symptom? Well, swelling. You can have deformities. We're back to the growth plates and things like that. If it's in the back or the neck, you may get a slouch. You probably will, because that discomfort causes a lot of fatigue, and you just want to get out of that pain as much as you can. So you'll see people, or if you notice yourself having that pain, you have that slouching posture. These pains can be really debilitating, so it can cause depression and anxiety for sure.
Yeah.
You know, so the best thing to do for managing this type of pain, well, let's put it this way. There's a lot of different regimens depending on the cause. So you can take pain relievers, so you can take your non-steroidal, anti-inflammatories. If you have a bone disease or infection, then you're looking at antibiotics. And then there's nutritional supplements. So we actually will prescribe, not just for bone pain, but for overall pains, nutritional supplements that have enzymes, that have anti-inflammatories, and some sort of pain reliever in there, like a white willow bark, all natural, but work on those tissues so they're synergistically healing all of the tissues that cause an instability or deficiency in the pain.
Nice.
All right, and then some things that you can do at home for self-care, rest for sure. Now, for back pain, rest used to be prescribed all the time, and then they said, well, we're finding that if you have back pain or disc pain, it's better to move. The rest wasn't prescribed anymore. But for bone pain, especially if it's infection or deficiencies in nutrition, you do want to rest. So you may have to use crutches. You want to get the area elevated, and you can try both hot and cold or a contrast of both. The other thing, when you're looking at these bone deficiencies, we're seeing vitamin D and calcium. Those are the two biggies for the bone density makeup, and make sure that you get that. So that's number 3, bone pain.
Well, let's jump into number 4.
Yes.
Soft tissue pain. So soft tissue pain is generally a discomfort around the bones. It may involve muscles, tendons, ligaments, or other support structures around those bones. They can present themselves as contusions or sprains or strains, tendinitis, bursitis, stress injuries, Basic overuse can cause a lot of that soft tissue pain where you just overdo it. There can be a swelling, a lack of mobility because of course it's too painful to really move through a soft tissue pain. A soreness and an anxiety that can kind of come with that too. It's like, how long is this going to last?
Right.
Is it going to take me out of work? Is it going to just stay with me much longer than I would care to have it there? In terms of helping that, you can utilize a light massage, range of motion, chiropractic, pain relievers, of course. Again, anti-inflammatories try to take the inflammation down because that's where that pain is arising from. Physical therapy is a possibility as well, depending on just how intense it is and how long it's lasting and how much it's keeping you from your regular range of motion. In terms of self-care, we're going to go back to kind of the classic RICE: rest, ice, compression, elevation. Along with ice, you can utilize heat too as it gets a little longer into the injury. First 72 hours, I like to utilize ice a little more to get that inflammation down as much as I can. And it is proven to be the most effective way to lessen that amount of time of healing as well, getting that rice within the first 3-day period. Also, you can utilize a light range of motion as well that is not led by a therapeutic provider as well. Much like with a lot of these other pains that we're talking about, patience over time. Some of these is, say, if it's a strain of the soft tissue, can be remedied in as fast as 6 weeks for a full healing of it. If it's a really bad sprain, say a high ankle sprain, something like that, it could take 18 months until you're fully healed from this.
Absolutely. Yeah, so just be, again, patience goes a long way.
Big time. So in talking about soft tissue pain, this kind of goes hand in hand with this next one too.
Right. So number 5 is going to be nerve pain. And that's what we definitely see a lot in my office, whether it is an acute injury or chronic pain. The cause is ultimately some sort of nerve pain or nerve impingement. Yeah. And that, whether it's damage or it's been there for a long time, or a quick impingement from a disc herniation or a disc bulge, all of that affects the function of the nerve fibers. Okay. Now, a lot of people know this as neuropathic pain, and diabetes is another systemic problem that you'll have that neuropathic or diabetic neuropathy. People have heard of that before as well. So those are different definitions of what nerve pain could be. Now, it could feel like burning, prickling, sometimes described like an electrical shock, pins and needles, even a stabbing pain. All of those type of system presentations would indicate a nerve type pain. So what do we do with that? Well, number 1, just like a lot of the other things that we talked about, there's inflammation that's involved. Right. So we want to try to bring the inflammation down. You may also feel that it's hypersensitive to temperatures, even touch. You may feel, kind of a creepy feeling from your clothes on the skin.
Creepy
feeling.
I like that.
Yes. And then also, you might want to know if it's coming from the central nervous system or the peripheral nervous system. Is it localized or is it throughout your whole body? That's going to really help with the diagnosis of what's going on for each individual person. So what's most common areas? So neck and back pain, I would say that's where most of my patients come from, would be neck and back pain. The causes are numerous. Then the extremities come. So
Or they could be directly correlated to the neck and back pain, and then
Oh, absolutely. Yeah, so
kind of go to the source.
I guess I should rephrase that. And if you do have a shoulder with radiating down the arm, if you go back to some of our other videos, I talk about a triad of care. So if something's radiating, we're going to look at all of the arm, the shoulder, and then the spine that supports that, so the upper back and the neck. So that whole triangle would be something where we're looking to treat there.
Awesome.
Yeah.
That's Dr. Fox.
That's the you only get that at my clinic. No, I'm just kidding. I'm just kidding. So management through physicians, someone like myself as a chiropractor, a physical therapist, a stretch trainer, pain specialist, medications and topicals are sometimes necessary. With nerve pain, it's not like a soft tissue where you can just pop a couple of Advil and it goes away.
Right.
Nerve pain is the one that where people come to me and they're like, I've taken this, I've taken Celebrex, I've taken gabapentin, I've taken this, and it keeps coming back. So we have to find, is that an impingement, or is it, where is that coming from?
And we're looking to remedy, not just mask.
Correct. And so all of those things you can kind of, I see patients that see me first because they're family members or someone they know has gone to a chiropractor. I would say the majority of people, if you have nerve pain and you have a shock-like pain, you're going to go right to the neurologist or the emergency room and then kind of go from there. But just keep in mind that whatever specialist you go to, that's the type of treatment you're going to get. So if you go on a more medical type of provider, they're probably going to treat you more medically with medications, where if you look at more of a physical medicine or functional, like a chiropractor, physical therapy, you're going to get kind of a whole body approach. Okay. Self-care at home, again, rest. Be careful with your range of motion. So if you're like this, don't try to straighten up right away. Your body is screaming at you and it doesn't want to go the other way.
Protect.
And those are the classic signs of a nerve impingement, and that's what you don't want to do. You may have to take some basic medications to manage that. And then if you do go to urgent care and they prescribe a muscle relaxer, hey, that's fine. You want to get through that, just know we don't want to mask it. What was the original cause? Is it a disc injury, or is it a muscle or soft tissue strain or sprain that's causing what you feel is nerve pain? Okay, because truthfully, the nerve root, when impinged, has no pain sensors. So your pain's coming from either the disc being bulging or torn, or within the joints, or within those soft tissues. So that's where all those nerve endings that you're feeling. So make sure that you understand the difference there. Again, therapy over time, if you're addressing the right cause, you're going to get the best outcome for the best long term. Make sure once it starts feeling better that you're still cognizant of the time it takes to heal, because nerve pain, just like soft tissue pain, is going to take time to heal, and it usually involves the soft tissue and the bone as well. So keep that in mind. That's number 5. Hopefully that was informative.
That's a lot. That was good stuff. And it really kind of brought everything together.
Absolutely, yeah.
And speaking of bringing everything together, this is our outro. We hope that you learned quite a bit about the different types of pains. Like I said, these initial videos for the pain series are just about defining the different types of pains, the difference between an acute or a chronic pain, kind of how bone pain, nerve pain, and soft tissue pain present themselves, how we can best remedy them. If you like the information that you got, please hit subscribe. We would love for you to kind of follow us on this journey, especially with this pain series, but also with some of the other series that we have as well.
Absolutely. Yeah, talking about pain, and we have 3 different parts to this, but talking about pain can be a little depressing for sure.
Sure.
This is what we do on a daily basis with our clients and our patients. And we have these little talks with people, and we want to bring that information to you. And like I said, it can be a little depressing, but you have to understand that we have empathy for you if you have this type of pain, and we want to bring the best knowledge to you, and hopefully we can change your life that way.
Yep. And we are the FitHealth Pros. I am Coach Sean.
And I'm Dr. Kevin.
Thanks for coming along on the ride.
Yeah, thank you so much. We'll see you on the next one.
We're talking, we're just hanging out, and we're ready to start. We're ready to start the pain series.